Hi Sagar, tell me about yourself.
Good morning, ma'am. My name is Sagar Biswas. I have completed my graduation in BA General from IC University in Solan. I live in Kolkata.
What is COPD?
The full form of COPD is chronic obstructive pulmonary disease.
What is HIPPA?
The full form of HIPPA is Health Insurance Portability and Accountability Act.
What is the modifier and its types?
Modifiers is a two-character code which gives additional information about a medical procedure. It has two types, CPT and HCPCS level 2.
What is angina pectoris?
Angina pectoris is a type of chest pain uh, uh, due to reduced fluid of blood in the heart.
What is thrombus?
Thrombus is a blood clot in the artery wall.
What are receiving chambers and discharging chambers?
Left atrium and right atriums are the receiving chambers, and left and right ventricle are the discharging chambers.
What is the Roman number of olfactory nerve and its function?
Olfactory nerves allows to perceive smell. Olfactory nerve enables olfactory system to sense of smell.
What are the parts of skeletal system?
Skeletal system has four parts: bone, cartilage, tendon, ligament.
What is supine?
Supine, laying face upward or having the palm of hand face superiorly.
What is pexy?
Pexy. Pexy is the surgical fixation is called pexy.
What is CKD?
CKD, chronic kidney disease.
What is puerperium period?
Puerperium period is the period of after delivery, when the body returns to its pre-pregnant stage.
What are the layers of skin?
Layer of skin. Skin has three layers: epidermis, dermis, and hypodermis.
What is
Epidermis,
amniocentesis?
amniocentesis, the surgical procedure to remove a small amount of amniotic acid for testing.
What is prone?
Prone, laying face downward or having the palm of hand facing inferiorly.
What is manifestation?
Manifestation. Manifestation, the visible symptoms for disease is called manifestation.
Can you explain seventh character of an ICD-10 code?
Ma'am, seventh character is the last code of ICD-10 and seventh character used to indicate the phase of treatment.
Need more, Sagar. What are the ICD guidelines for pregnancy?
The guidelines of pregnancy. Every condition can be coded in normal pregnancy. C section always primary. Z section code assigned at last. Complication of delivery is second degree code. Seventh character depends upon how many fetus has been taken out. Code, antepartum and postpartum period, and outcome of delivery should be added in the national record book.
What is ectomy?
What is ectomy? Ectomy, the surgical removal of a specific part of the body is called ectomy.
What is the medical term of kneecap?
Kneecap. Kneecap is a bone in front of knee joint.
What is glaucoma?
Glaucoma is a type of disease that damages the optic nerve of eyes.
What is pancreas and its function?
Pancreas is a glandular organ that produce digestive enzymes and hormones. That digestive enzymes break down protein, cholesterol, fat, uh, carbohydrate in the duodenum of small intestine, and the hormone regulates the blood blood sugar level.
What is encephalitis?
Encephalitis is the inflammation of brain uh, due to infection.
What are the categories of diabetes mellitus?
Diabetics is a collection of disease that result too much blood sugar in too much sugar in the blood. And diabetics is mainly divided into two types: primary DM and secondary DM. Primary DM is divided into type 1 and type 2. Type 1 is insulin dependence DM below 30 years, we can see it, and non-insulin dependence DM is then it is normally occur after the 30 years of age. And secondary DM happen due to present illness, condition, drug and chemical and other reason.
What are connective tissue disease conditions?
Connective tissue supports and protects and gives structure to the surrounding tissue, and it also forms the organ of the body. And bone, cartilage, tendon, muscle, ligaments are the types of connective tissue.
How many bones in an adult, children, and fetus?
In adult, 206 bone, in baby 300 bones, and in fetus 306 bones.
Can you explain the functions of heart in detail?
Functions of heart: superior vena cava and inferior vena cava carries deoxygenated blood into the heart's right atrium. Blood passes through tricuspid valve into right ventricular. Blood pumped into pulmonary artery, and it carries the blood into lungs, where the blood is oxygenated. The oxygenated blood is carried by pulmonary vein into the left atrium, and from left atrium the blood is passes through mitral valve, and it comes to the left ventricle. From the left ventricle, blood pumped to the aorta and the and it eventually reaches the body by arterial system, and where the where the from the surrounding tissue it collects deoxygenated blood, and in return there goes to the oxygenated blood, and the deoxygenated blood is carried by ventricular system, and it reaches the it eventually reaches the superior vena cava and inferior vena cava.
Okay, Sagar. Thank you.
Welcome.